Diet and treatment options for fibromyalgia, fibroid. Fibromyalgia is a chronic condition that causes pain, stiffness and tenderness of muscles, tendons, and joints. It is also characterized by insomnia, feelings of tiredness, chronic fatigue, anxiety, depression, and impaired bowel function. This condition is not life-threatening and does not cause bodily damage, deformity, or injury to internal organs. Fibromyalgia is sometimes referred to as fibromyalgia syndrome. Fibromyalgia was previously known as fibrositis. When this happens, it makes sense to turn to alternatives, including a fibromyalgia diet. Some research suggests that over 40% of fibro patients' symptoms get worse when they consume certain foods. There is also some evidence that indicates simple adjustments to diet can ease fibromyalgia pain. Doctors and scientists do recommend a few adjustments in your diet, which can make a huge difference in controlling the symptoms of fibromyalgia. To find out what's good for you, try eliminating one food at a time. As you make changes to your diet, keep in mind that people with fibromyalgia benefit the most from a variety of approaches to managing their symptoms. There are some suggested supplements and foods to eat with fibromyalgia. These are the good foods that you should eat to help your body fight against fibromyalgia symptoms. When a person is lacking this essential mineral, the person will experience body pain, anxiety, fatigue, muscle spasms, migraines, and other symptoms. The pain of fibromyalgia can be difficult to get under control. For most, it takes a combination of treatments which may include medication, gentle exercise, complementary alternative therapies, and lifestyle changes. One complementary option some fibromyalgia patients have found effective is nutritional supplements. Following are 9 supplements commonly recommended for fibromyalgia pain. Below are some of the foods you should try incorporating in your fibromyalgia diet. 1. Fruits and vegetables. These foods make up the foundation of a healthy diet. Fruits and veggies contain phytochemicals, natural chemicals found in some plant foods, and antioxidants, natural pain and inflammation fighters. Fruits and vegetables are full of antioxidants and vitamins promoting nervous system health. Your diet should include plenty of leafy greens like kale or spinach and fruits of all colors. 2. Lean protein. Eating some type of protein at every meal, whether it's chicken, fish, beans, nuts, or peanut butter, gives you energy by fueling your muscles. With fibromyalgia, it's common to feel low on energy, so bulking up on protein is essential. 3. Omega-3 fatty acids. These essential fatty acids may help reduce inflammation and fibromyalgia-related pain. Omega-3s are found in flaxseed, walnuts, olive oil, flax seeds, soybeans, fish, such as salmon. It reduces pain and soreness, fights inflammation, slows cognitive decline, fights rheumatoid arthritis, may help reduce symptoms of depression. 4. Vitamin D. If your diet is very low in vitamin D, you may be dealing with muscle pain. Get your vitamin D from fish, such as salmon, mushrooms, and eggs, to relieve your pain and other fibromyalgia symptoms. Also, many cereals, breads, and yogurts are fortified with vitamin D. It promotes muscle recovery, reduces muscle and joint pain, promotes healthy bones. 5. Whole grains. Eating whole grains, such as whole grain pasta, quinoa, and brown rice, gives you a healthy dose of energy, instead of dragging you down as foods, such as cookies and white rice, can do. 6. Drink plenty of water. 6 to 8 glasses are recommended. 7. Food rich in vitamin B12. Vitamin B12 converts fuel carbohydrates into glucose, which the body uses as a fuel source to generate energy. If your body does not get enough B12, you will likely begin to feel fatigued and weak. 8. Food rich in magnesium. Most people, especially people who suffer from fibromyalgia, are deficient in magnesium. Magnesium deficiencies have very similar symptoms to that of fibromyalgia. Dark leafy greens, nuts like cashews and almonds, and soybeans are all good sources of magnesium. Relieves pain and tenderness from sore muscles, improves cognitive health and reduces fatigue or weakness. 9. Iron. Promotes oxygen flow, fights fatigue and exhaustion, builds healthy muscles, improves cognitive function, and strengthens immune system. Sources are spinach, broccoli, whole grains, olives, legumes. 10. Turmeric, curcumin, natural pain reliever, fights harmful free radicals in the body. 11. Oranges. They are packed with vitamin C, which has anti-inflammatory properties. Honey and cinnamon have the same anti-inflammatory action, so having some orange slices drizzled with a tablespoon of honey and a sprinkle of cinnamon is a good option to include on a fibromyalgia diet food list. 12. Avocado with berries. The avocado contains healthy fat that can be good for those with fibro. The vitamin E can help with muscle pain, But avocados also contain vitamin B, C, and K, as well as minerals such as manganese and iron. Adding an antioxidant like berries with avocados can be even more powerful. You can make smoothies with avocado and berries. 13. Lemon juice with chia seeds, also a good option for the fibromyalgia diet menu. Lemon juice has vitamins and minerals to help with inflammation and pain reduction. Chia seeds contain protein, fiber, omega-3 fatty acids, and minerals, making them one of the most nutritious foods you can consume. 14. Papaya and almonds. This fruit is nutritious and easy to digest. When combined with almonds, it gives you a nutrient-packed meal. 15. Apples and bananas. Filled with vitamins and fiber, they can give you a much-needed energy boost. When fatigue is a big issue, you can also turn to dark leafy greens for energy. 16. Panax ginseng. This plant is also known as Asian ginseng, Korean ginseng, and Chinese ginseng. It is available as an herbal supplement. The average recommended dosage is 200 to 500 milligrams daily. Panax ginseng can also be found in teabag form and as a root in its natural state. You can use 1 teaspoon of chopped, boiled root to make 1 cup of tea. While relatively new to the Western world, ginseng has been used medicinally throughout Asia for thousands of years. A study-trusted source on Panax ginseng use in people with fibromyalgia indicated that it is effective for reducing pain and the number of tender points found on the body. The same study also indicated that ginseng may improve quality of sleep, decrease fatigue, improve overall life satisfaction. 16. St. John's wort, a flowering herb. St. John's wort is available in tablet and capsule form. St. John's wort is also available as an extract in oil form. Its recommended dosage ranges from 250 to 300 milligrams, taken 2 to 3 times daily. St. John's wort may help alleviate depression in people with fibromyalgia. It may also help reduce inflammation. 17. Melatonin. Melatonin is a natural hormone. It's produced in the pineal gland, which is located in the brain. Melatonin is also manufactured synthetically and is available in supplement form. This hormone helps to regulate sleep cycles, which can make it beneficial to people with fibromyalgia. Poor quality of sleep and exhaustion are common symptoms of this condition. Melatonin may help improve sleep quality and reduce fatigue. Its recommended dosage ranges from 0.3 to 5 milligrams daily. 18. Chlorella perennidosa. Chlorella perennidosa is an alga harvested from freshwater sources. It is high in many macronutrients, including vitamins, minerals, and protein. It is available in supplement form. A study-trusted source found that people with fibromyalgia experienced better quality of life due to an overall reduction in symptoms when taking chlorella in supplement form. Study participants were given a combination of 10 grams of pure chlorella as a tablet plus ml of a liquid containing chlorella extract daily for 2 to 3 months. 19. Acetyl L-carnitine, Alker. Alker is an amino acid produced naturally by the body. It is also manufactured synthetically and available in supplement form. A study, reported in Clinical and Experimental Rheumatology trusted source, indicated that Alker may reduce pain and depression in people with fibromyalgia. Some participants in the study were given a dosage of 1500 milligrams of Alker daily for 12 weeks. Others were given duloxetine, an antidepressant. Both groups showed an improvement in symptoms, although researchers indicated that more studies are needed. 20. Alpha-lipoic acid. Alpha-lipoic acid is an antioxidant that exists in every cell of the body. It is also found in foods such as brewer's yeast, spinach, red meat, and organ meats. Alpha-lipoic acid can be taken as a supplement in capsule form. It can also be given via injection. It may help reduce diabetic nerve pain. Alpha-lipoic acid may also protect the brain and nerve tissue from damage caused by free radicals. Due to alpha-lipoic acid's positive effect on diabetic nerve pain, a trial study trusted source is currently underway, designed to analyze its potential for reducing pain in people with fibromyalgia. 21. SAMe, S-adenosyl methionine. In one double-blind study of 44 patients with primary fibromyalgia who took SAMe, improvements were seen in the areas of clinical disease activity, pain, fatigue, morning stiffness, and mood. For fibromyalgia patients who are also dealing with depression, clinical trials have shown SAMe to be comparable to prescription antidepressants. 22. 5-HTP, 5-hydroxytryptophan. 5-HTP is thought to work by boosting the levels of serotonin in the brain, which is known to be low in many FM patients. In one double-blind, placebo-controlled study, People taking 5-HTP showed a significant improvement in pain, number of tender points, stiffness, anxiety, fatigue, and sleep. 23. Boswellia serrata, also known as Indian frankincense, was frequently used in ancient Indian Ayurvedic medicine. Boswellia is a tree resin known for its ability to soothe joint, muscle, and connective tissue pain. It is also one of the rare treatments that decreases elastis, an inflammatory mediator found to be elevated in those with fibromyalgia. 24. Ginger. Eastern medicine has used ginger for centuries to treat a wide variety of conditions including pain. Several Western medicine studies have shown ginger to have anti-inflammatory and analgesic properties similar to nonsteroidal anti-inflammatory drugs, but without the dangerous side effects. A 2010 study demonstrated that it can effectively relieve muscle aches and pains, concluding that ginger is an effective pain reliever. 25. White willow bark. The use of willow bark to treat inflammation goes all the way back to the time of Hippocrates, 400 BC, and is still used today to reduce inflammation and ease pain and headaches. White willow bark contains salicin, a chemical similar to aspirin, which scientists think is responsible for its pain-relieving effects. Studies comparing white willow bark to various nonsteroidal medications have found its effectiveness to be comparable. Foods to avoid with fibromyalgia. Limiting certain foods may also help ease fibromyalgia. The foods below may aggravate pain and other fibromyalgia symptoms. Pay attention to how your body and fibromyalgia react to these foods. There are some foods that are frowned upon for fibromyalgia. These foods aggravate fibromyalgia and can lead to flare-ups. Avoid these foods if you have fibromyalgia. 1. Foods sweetened with aspartame. Chemicals found in this sweetener can activate neurons in your brain that may increase your sensitivity to pain. Aspartame is found in, for example, some soft drinks, the diet ones, and artificially sweetened yogurt. 2. Highly processed and fried foods, especially foods that contain food additives, monosodium glutamate, MSG, and/or nitrates are examples of food additives, which are chemicals that are used as flavor enhancers. MSG is found in some frozen dinners and Asian foods. Nitrates can be found in lunch meats, hot dogs, and bacon. 3. Nightshade vegetables. These vegetables include bell peppers, eggplant, chilies, paprika, potatoes, and tomatoes. Although these veggies are highly nutritious, they can trigger fibromyalgia-related pain. Studies have shown that 74%–90% of people with inflammatory conditions such as arthritis or fibromyalgia experienced increased inflammation and pain after eating nightshade family fruits or vegetables. 4. Sugar and caffeine. Even though fibromyalgia may cause fatigue, it is important to stay away from sugar and caffeine. Caffeine only gives a small boost and is usually followed by a longer period of fatigue. In addition, it interferes with getting a restful sleep at night, something patients may already struggle with. 5. Carbohydrates. Refined carbohydrates such as cookies, many breads, pastries, and white rice are digested quickly, causing blood sugar levels to spike. These fluctuations can make the fatigue and pain of fibromyalgia worse and contribute to overeating. When eating carbohydrates, whole wheat sources should be chosen. Whole wheat foods digest more slowly. 6. Meat and dairy products. Many people who have fibromyalgia are also lactose intolerant, so dairy products can exacerbate pain. However, getting enough calcium is important, so if you can't eat yogurt or drink milk, eat foods fortified with calcium or talk to your doctor about taking a daily calcium supplement. For people with fibromyalgia, it may help to limit excess dairy intake. This is because many dairy products contain saturated fat. People should try to opt for low-fat versions or dairy alternatives such as soy milk. It may also help to limit the consumption of red meat. Instead of eating red meat every day, opt for turkey, fish, and vegetable-based substitutes. 7. Avoid peanuts. While nuts in general are healthy, peanuts are the exception. Because of the way peanuts are grown and stored today, they often top the list of foods that can cause inflammation. 8. Avoid simple carbs, whole wheat and whole grains. Fibromyalgia patients often experience general hypersensitivity, which translates into increased sensitivity to blood sugar highs and lows. Avoid simple carbs like white sugar, white flour, and even wheat if possible. Also, be cautious with whole grains, since they can quickly elevate blood sugar levels. 9. Unhealthy fats. Vegetable oils, such as corn oil, safflower oil, and peanut oil, have an inflammatory effect, especially when used to fry food. The medical literature has linked fried foods to worsening of fibromyalgia symptoms. 1. Unhealthy oils are a common ingredient in many processed foods, such as cookies, donuts, and crackers. Pizza and cheese are also major sources of unhealthy fats. 10. Alcohol. While some research has found moderate alcohol use can ease symptoms for some people with fibromyalgia, report alcohol causes symptoms to flare. Drinking alcohol while taking certain medications prescribed for fibromyalgia, such as anticonvulsants, antidepressants, and acetaminophen, an ingredient in many medications, could cause harmful interactions. 11. Avoid gluten and yeast. Foods labeled gluten-free can be tricky. These frequently include gluten-free substitutes that shoot blood sugar up. Common gluten-free substitutes are starchy flours such as potato flour and tapioca flour. Gluten intolerance frequently accompanies other fibromyalgia issues. It is also frequently associated with fatigue in patients with fibromyalgia. In the case of yeast, several doctors say it fosters the overgrowth of the yeast fungus in the body. This contributes to joint and muscle pain experienced by people with fibromyalgia. 12. Avoid food additives, this including MSG, monosodium glutamate, and nitrates. While MSG enhances flavor, it can increase pain for patients. Experts say MSG causes a reaction similar to aspartame, which is classified as an excitotoxin and has the same potential for affecting NMDA receptors. Foods with added nitrates commonly include lunch meats, ham, bacon or bologna. These should be avoided. 13. Beverages. Caffeinated beverages like coffee, tea, and soda can be problematic for people with fibromyalgia. Herbal teas may be a better, safer option. Seltzer water, coconut water, and unsweetened fruit juices are great alternatives to soft drinks. If you consume alcohol, try reducing your intake, particularly sweet cocktails and high-carbohydrate beers. Drug treatments for fibromyalgia. Fibromyalgia treatments usually focus on trying medications designed to reduce pain or improve mood, as well as therapeutic treatments to ease pain and enhance well-being. Here are the drug treatments for fibromyalgia that some people use to help manage symptoms and why they are not always effective. Many people take painkillers for their fibromyalgia symptoms, such as paracetamol or ibuprofen. Some people find that these help relieve some of their pain, however, they do not work for everybody. Similarly, pain-relieving gels that are applied to the skin do not always help, but some people find some temporary relief using these. Some people are prescribed drugs that help with nerve pain, such as pregabalin, which may help. Lyrica, pregabalin, is an FDA-approved drug that can be used to treat fibromyalgia. Some people choose to take antidepressant drugs to help relieve these symptoms, such as citalopram, amitriptyline, duloxetine. There is a range of medications your doctor may suggest as a fibromyalgia pain solution. These include pain relievers. Your doctor may recommend over-the-counter pain relievers, such as ibuprofen, Advil, acetaminophen, Tylenol, and naproxen sodium, Aleve. Opioid medication, on the other hand, is not recommended because it typically only worsens the pain over time. Antidepressants. Antidepressants like duloxetine, Cymbalta, and milnacipran, Savella, can reduce fibromyalgia fatigue and pain. Additionally, your doctor might prescribe antidepressants to treat depression and anxiety associated with the condition. Muscle relaxers. To help you sleep, your doctor may prescribe you with amitriptyline or a muscle relaxer like cyclobenzaprine. Anti-seizure drugs. Some anti-seizure medications can be used to treat fibromyalgia pain. These include gabapentin, Neurontin, and pregabalin, Lyrica. Other healthy habits to adopt. There is some evidence to suggest that other complementary methods help with fibromyalgia. These include exercise. Exercising while in pain may seem like a bad idea, but studies have shown that non-intensive exercise, such as swimming, walking, or stretching, helps to loosen muscles and reduce stiffness. As an added bonus, regular exercise helps patients sleep better at night. According to the American Academy of Family Physicians, engaging in aerobic exercise for 20-30 minutes per day on 2-3 days per week may help reduce symptoms and fatigue in people with fibromyalgia. Weight watching. A sedentary lifestyle due to pain and even medication can contribute to obesity among fibromyalgia patients. With regular exercise and a good diet, those suffering from fibromyalgia can have a healthy, happy lifestyle. Be sure to consult with your doctor before adding to your diet because some foods may interfere with how your body absorbs certain types of medications. Sleep hygiene. Getting regular, quality sleep can also help people manage the symptoms of fibromyalgia. So if you like this piece of health information, kindly subscribe to my YouTube channel.